Good morning to you both, and it's good to see you.
Good
to see
morning.
you.
Thanks.
Good morning. Good morning. Senator, you and I have talked about our personal experience. I've talked about my mom, and you are willing to share about your mom and dad, the former governor, and your mom.
Right. A really difficult situation. I think my mother, I remember her looking at me probably 15 years before she passed away saying, "Shelley, I'm losing my mind." And her mother went through almost the exact same pattern. And so she knew what was happening to her. She closed in. She lost her confidence. She became afraid to do certain things and be around certain people. And I don't think I really understood it, but she had my dad kind of right there with her, helping her. And then, he's wearing out at the same time. They were in their 80s. And then my dad had some kind of an incident in 2010 where I don't think it was a stroke, but it was something that really took him down gradually, and then he never recovered mentally and went into a different type of dementia. I mean, he would sort of fog out for 55 minutes and then 5 minutes of clarity. You might find, and you have to find some humor in something, and he would say, as you would imagine him saying, if you would sit there and watch TV with him, he would say, "Oh, I built all that, and I built everything in Morgantown." And so he had a different type of dementia, but it was very difficult. And the one thing I will say is I wanted a book. I wanted a book that would tell me, okay, when this happens,
what do you do?
This.
What do you do? When
that happens, do that. And, it was interrupted sleep and lack of appetite, losing weight, all kinds of things, and very, very difficult. And my brother and sister and I met the challenge, but it was really, really the hardest thing I've ever had to do.
Did you find, as I did, and I think Dr. Rezai will get to this, as many people do, that you don't plan for it, and then it starts to happen, and you go, okay, now you're trying to figure it out. You're trying to build the car while you're driving it.
That's exactly right. And we were lucky to be able to find caregivers, and we were lucky that my parents had resources to be able to meet that challenge. A lot of people don't. A lot of people do not, and that's where families have to quit jobs. People move to help their families. Very, very difficult circumstances. And I if you try to reason your way out of it, you finally come to the realization is their capacity to reason has left them.
Right. Right.
And so then it becomes, all of a sudden you become the parent.
Right.
And I'm taking the keys from the car, and they're mad, and all those things.
Dr. Rezai, does that story sound familiar to you?
It does, and basically it's typically the brain is getting worse for 15 to 20 years before the first external manifestation of dementia or Alzheimer's. First time your loved one has difficulty paying the bill at a restaurant, or is being repetitive, or can't find their way around. And all of these manifestations are occurring after 15 to 20 years of brain degeneration. So it's important that we can do research so we can detect this earlier on, but typically Alzheimer's affects your thinking, your memory, your anxiety, behavior, finding your way around, and so many elements of your life.
Dr. Rezai, what's the difference, though, and this is what I think a lot of people struggle with, between not being able to find your car keys, not being able to remember why you went into the room or opened the refrigerator, and having onset of some form of dementia? What's the difference? Or is it all the same?
No, so normal forgetfulness goes on with anybody aging. It's a normal process of aging. And also, all of us are overwhelming our daily lives with so much input from the cell phones and families and responsibilities. But when it becomes consistent, persistent, there's a pattern that happens where there's forgetfulness. And then that really leads to a pre-Alzheimer's state or pre-dementia, what we call a mild cognitive impairment, which is a precursor to Alzheimer's. But it's not just Alzheimer's. There are many different types of dementias.
Right.
We call them Alzheimer's disease and related disorders, Lewy body disease, vascular dementia that comes from having a history of high blood pressure and diabetes.
Is it important to know the kind, or can you accurately diagnose the kind? Shelley, did you know the kind that your parents... my mom, we just said she's 90, and the doctor said she has dementia, and we did not go for a further analysis.
I didn't either, because I felt like... I have bitter regret on that.
Really?
Only because I think it would be helpful and useful in research for future people. I didn't think it would help them. I didn't want to put them through it, because it's humiliating when you can't remember who the president is, or you're not sure what year it is, or You have your clothes on not exactly the way you're supposed to have them on, and I didn't want to take them out like that in certain circumstances, and that was difficult. But I didn't take them for the further diagnosis because I just thought it's not going to matter to them.
It's not going to matter. Do you need to get an exact diagnosis,
I think it's helpful to be seen by specialists that can help you get a diagnosis, because many times it can be lifestyle changes and modifications, and sometimes it's very early on, or it may not be Alzheimer's, maybe something else. So I think it's important to get a diagnosis early on, and then also for the loved ones and the family and the patient, answer the questions. Many times if you're diagnosed with it, you get very scared and confused because there's no cure. So understanding what happens, what's the next steps, coping with it, questions for the family, how do I deal with it? Those are very important.
And on that, and again, we're going to walk through this in stages, and Senator Capito is with us, and Dr. Rezai from the Rockefeller Neuroscience Institute, is how do you have that conversation, Dr. Rezai? And I think people have gone through it, or they're thinking right now, I've got to have that conversation. How do you begin that? And I did with my mom. How do you do it?
Well, I think it's important just to, if somebody's, first you got to get a diagnosis. I think it's important to say which type of dementia, or is it before dementia or mild cognitive impairment. All of these are different stages, so there's many different options. But I think a discussion about the reality of this that's going to hit the family, and then that this is a progressive condition that will likely get worse, and then also adjusting your lifestyles. I think there's a lot of things you can do earlier on in terms of diet, in terms of exercise, reducing stress, increasing sleep, that may slow the progression. But I think it's important to find out if you have normal aging, which is normal for all of us, versus accelerated pathological aging.
The conversation, though, and Senator, let me go to you, and with my mom, it was, she started behaving in a way that we said, well, something's going on here. So we sat down and talked about it and said, we need to go to the doctor, and the doctor needs someone you trust, and the doctor needs to, run some tests, and then we need to see whether you can drive anymore, whether you need to move out of your home. And did you have those kinds of conversations with your mom or your dad?
We did, and my mother was on. I'm trying to remember what was the common medicine that
Aricept?
you would.
Aricept. Yeah,
my
Aricept,
mother was on Aricept, and it did slow her progression. It appeared to at least slightly make things a little bit less worse in terms of the progression. But in the end, I think she started developing, some side effects with that,
mm-hmm.
and so, all I could say to my mother was, we're here for you. We're going to take care of you. I didn't tell her, no, you're not losing your mind. I didn't want to lie to her, and she understood what was going on. And so, whether we had the face-to-face discussions. With my dad, with that forceful personality that he had.
I would have dreaded that conversation with Arch.
Arch, yeah. I basically told him I was taking over all of their personal and financial affairs.
And how did he react?
He said, okay, but, and here was a moment of clarity for him, you can't veto me. He's still talking in political terms. But you know what? Then it faded out. He would sort of do things like go around the house and turn all the lights on all the time. Just kind of that repetitive behavior, I think, that a lot of people have. Honestly, I haven't told this publicly, but my mother would sit there and fold Kleenexes into very methodical piles. She had stacks of them. What was that, doctor? I don't know.
Go ahead.
Yeah, so this happens, the repetitive behavior, forgetting things and repeating things, and the brain is trying to adapt. You get obsessions, compulsions, anxiety, all this are manifesting in the brain, not able to connect, to communicate properly, different parts of the brain. And so very common to see anxiety, and the behavioral components are very significant. People get scared, they get agitated. Many families have trouble with that, getting screaming, having fits, and these are very common. I think it's very tough for the family to see their loved ones have these problems. They can be very scary, actually, for some families.
When we come back, we're spending some quality time talking about dementia and related cognitive disorders, because it just doesn't get talked about a lot. It's an awkward subject. I would like to give a phone number, a helpline, 1-800-272-3900, 1-800-272-3900. 3900. If you have any questions or comments, you can text me at 304-TALK-304. And again, I'm just trying to raise some, and our guests, Dr. Rezai from the Rockefeller Neuroscience Institute here in Morgantown, and Senator Shelley Moore Capito, who both her parents had dementia, and just trying to raise some awareness about this. Let's talk about some of the practical things. Dr. Rezai, I'll start with you on just if you're going to try to keep mom or dad or the spouse in the home, some practical things you can do to try to make the home safer.
I think safety is critical in terms of fire safety, in terms of stove and putting the teapot on the stove or the stove on, being a fire hazard. You got to make sure you know where the firearms are, and that's also important to know. Also, water being kept on, and people sometimes burn themselves if it's hot water, cold water, not knowing. So really, it affects, again, it's different for each family member. Sometimes it affects the way they can dress themselves, feed themselves. So really got to make sure the house is safe in that regard, because they're going to be confused, they're going to keep the stove on, and they may cause harm to themselves and the others.
Fall risk as well. Rugs, cords, things like that, steps, those kinds of things?
Absolutely. You got to make sure that the fall risks are very high, and often people with Alzheimer's, when they fall, that can be very difficult for them in terms of recovery. So you got to make sure that you fall-proof the house and going up and down the stairs. So everything is going to be difficult.
Senator, your mom and dad stayed in the house in Glendale.
They did. For
how long? And did you try to do things there? I know you had care, you had 24-hour care, but did you try to do things in the house?
We did, and luckily they were already living on one floor, so that's good. My sister was very diligent. Lucy was very diligent up there every week, spending about 2 days. So that was a great eyes and ears on the ground for them. And I think in terms of also what we found is if they did fall, which that happened, and and we take them to the hospital, then it just compounded the confusion.
Yeah.
And it's very difficult for the caregivers, for the doctors who are trying to treat, because they didn't understand why they've got to sit there. I remember, my mother was very, very restless. She's pulling out her IVs and all this kind of stuff. And so that, if you can eliminate those trips to the hospital, I think that's a critical part of having better care.
I think that's a great point. And, Dr. Rezai, all due respect to the medical profession, but I understand, too, like the senator's situation is that something happens, and, to be safe, they better go to the hospital. And sometimes that can be more traumatic because you're there, you're waiting, you're being checked out, you're waiting, it's confusing for them, and they finally say, well, nothing's broken, you're okay. Can you speak to that?
No, and I think it's important that people with Alzheimer's, they want to be in familiar environments. So when you take them out of the familiar environment, they have difficulty coping with it, and they get scared, they get anxious. So I think it's important to diagnose if somebody's got a broken hip from a fall. It's important, but I think a key point is that the patients have to be in their familiar environment. When they're out of that, they struggle significantly. And if you're going to the hospital, maybe you can be with them and bring something that provides comfort for them or something that they like to do. But it's a problem because medicine is very challenging these days. It's fragmented, so you have to go through many tests. It's not coordinated. So that's why we have to work harder to put the pieces together and help the patients and families. But it's that familiarity that's very important. They like to be do the same thing over and over that they like.
I'll tell you both is that we took my mom from, she was at here in Morgantown, and she ended up at the hospital a couple of times for a variety of reasons, falls and things. And finally I had a very healthy conversation with the folks, and I said, unless there's something obvious, unless she seems concussed or has a broken bone or don't go, don't go. And they said, well, we're doing this out of caution. And I said, I understand that, but it is more traumatic to do that than whatever minor injury she may have had. Doctor, can you speak to that? Does that now maybe that's not the best medical advice, but from a practical standpoint, and Senator, maybe you can relate, that worked. That worked.
I think it's very important for people to talk to their loved ones because as we all age, there's a higher chance of getting dementia. So you need to communicate what do you want if something, God forbid, happens to you. Mm-hmm. And it's important that your family knows if you get dementia, how do you want it managed? And that's a personal decision with the individual and the family. But you're right, because you got to use some practical common sense here. So if you take him to the hospital for every little thing, then and the hospital is not a safe environment in terms of getting exposed to infections and others. Getting pneumonias and falls are probably the biggest causes of death that happens with Alzheimer's disease.
Senator, did your parents have living wills? Were there directives known?
They did. They had filled those out, and they were very, very helpful. They had the do not resuscitate aspects of that. They had thought this through, and that was very helpful and comforting to both my brother and sister and I.
That is extremely. We had that too, and we had the conversation with my mom, and she had a living will. We had it all redone, so the directives were known, and where she was staying, the directives were known. And something I learned, Senator, was that I thought that you only got hospice when someone was right near death. We got hospice months ahead of time, and I didn't know you could access them, and that Medicare pays for hospice, and so we had hospice for months, which was a great aid in the last half year of her life. And I didn't know you could get hospice. No, okay, she's dying. Did you know that?
Well, I found that out during this journey. And both my parents had hospice. My dad got kicked off of hospice, actually.
Because he wasn't declining?
He wasn't declining enough, so he had to rejoin hospice at the end. And then, not talking about the final days, but to talk about the final days, hospice was incredible. But hospice is not just about the final days.
Right.
And we've actually passed a bill and have been working on a bill with palliative care, which helps with these kinds of issues to make sure that Medicare pays for that as well. And so I for some reason, I think some people are afraid of hospice. It's like you're giving up. It's the end, but it's such a comfort. It's such a powerful.
Yes.
It was for us, and we were able to access that at the advice of our medical professionals.
Yeah, it helps you. We found it as a great help to manage, and they have dealt with it all the time. Right. So they were helpful not only in the final days, but in the months leading up to that. Also, did you want to mention anything legislatively before we take a break?
Well, we've tried to work on some legislation, not just funding, and I'd love to hear the doctor's advice on this, on early detection. We've tried to introduce early detection of Alzheimer's at the Know Your Medicare, your first exam that you get when you get onto Medicare. And the other thing is caregiving. We've tried to help with, we're trying to help with more avenues because the caregivers get worn out.
Yes.
And
and we're going to get to that. I mean, the health of the caregiver.
Yeah. And then the research, which is what they do so well. And he does amazing things.
I think the goal here is I'm not sure we're solving anything, but we just want to raise awareness. Let many of you know who are going through it, have gone through it, may go through it, that you're not alone. That it is challenging. Everybody struggles with it, especially, not only those who are going through it, but also the caregivers. There is around-the-clock Alzheimer's disease information support at 800-272-3900, 800-272-3900. And there are a lot of resources out there to help answer questions that you'll have, because most of us don't pre-plan for this. You get into it and you're trying to figure it out. There's a lot of good advice out there. Text, Hoppy, thank you for sharing this discussion on dementia and highlighting the need for care and compassion on this difficult issue. Text, Hoppy, dementia is a thief that robs everyone involved, leaving behind frustration, anguish, and heartache. All the more reason to fill your memory boxes while you can and comfort your loved one with the beautiful memories that they have lost. Text, Hoppy, my husband had a hospice here at home for 2 years during his dementia. It was a huge help. Hoppy, my dad went in and out of hospice as well. Many think it's a place too, not a program. It's a program. It's a program. Let's see. Okay, so just some of the observations there. Dr. Rezai from Rockefeller Neuroscience Institute, Center Capito. Some of the behavioral changes that you'll see in people that Shelley saw in her parents, I saw in Mom. What are the prominent behavioral changes that you often encounter with dementia?
I think fear, anxiety, stress, repetitive behavior, ruminations, repeating things, having obsessions about things. Some people have difficulty, obsessions about their clothes, going to the bathroom, futzing around with different things. So these are all the behavioral manifestations that occur at the same time as thinking and memory manifestations. And it can be very tough for families to watch that.
When they engage in repetitive behavior is a very, very common one. Yeah. And when let's just pick that, when they start to do that, what is the caregiver supposed to do? Because there is a tendency in human nature, there's a tendency to correct. But my understanding is don't correct, so how do you manage?
I think you just have to understand that this is a part of the disease, is part of Alzheimer's, and understand that this is a manifestation of it, and be compassionate and understand that they can't help themselves, individuals that are doing this. So you just have to understand it's part of the disease and cope with it. And but if it's a safety issue, then you have to address it and try to correct the behavior, but usually it does not get better. Sometimes medications can help if it's too obsessive. But really, from a behavioral changes or medication combination, we can try to help reduce some of these behaviors if they're severe.
Senator, what did you do when you encountered the inevitable repetitive behavior, those kinds of things, or your mom and your dad asking you the same thing over and over and over again, and you're smiling because I'm sure you went through it as I did.
Definitely happened, yeah. and it began happening earlier with my mother. And she would tell some of the same stories. Or, I was just thinking, my parents always loved to watch television. Mm-hmm. And they would love to watch sports on television, especially the Mountaineers. But they were football fans, basketball fans. They just loved sports. And they lost that love of watching TV. They couldn't, the only thing they would watch were game shows. And they had no idea, really. I think it's because the game shows always have the buttons and the lights and all that. So they lost that. And we kept turning the TV on and turning up louder because Dad was losing his hearing. And really, that was kind of a dumb thing because it wasn't occupying any of their time. And I was thinking about what I mentioned my father going around the house turning on the lights. Then I just now remembered myself. His obsession was fixing lamps. He obviously had a light obsession. And so we found after we started cleaning out the house, all these broken down lamps where he'd been trying to fix them and everything. I just basically went along with it. I mean, I'm a pretty patient person, and I didn't try to fight it. If Mom wanted to tell me the same story 15 times, I sat there and listened to it. I did the same thing. If it was a story, I just listened to it, for the umpteenth time and tried to put it in context of this is a memory but if it was something that was problematic to her care, something like that, I would try maybe to redirect, right, doctor, to get that person off the subject and onto something else. If she's saying, I'm not going to dinner, you can't make me go to dinner, you try to redirect, right?
Exactly. And I think that one key thing is that people need to understand the stress and the impact this has on the caregiver, the spouse, the family. And that's really important because the caregiver now has got the burden of taking care of everything in their daily lives, plus taking care of the loved one and dealing with the emotional aspects and seeing their loved one who was probably very strong person in their lives, and they looked up to them and deteriorating and sort of the light fading in them. And it's very tough to see them. So I think the stress and anxiety for the caregiver is very significant, and we cannot ignore that. So we have to have programs to help the caregivers understand what's going on, answer their questions. The more empowered you are understanding what the disease is and the manifestations, the more you can accept it. And I think you also need to deal with your own health, sleep, reduction, stress, and anxiety, because otherwise, many people who have loved ones with chronic disease also get chronic conditions themselves. So you want to prevent that or minimize that. You got to take care of yourself like you do in the airplane. They say, put the mask on yourself first, then put in your loved ones. You got to take care of yourself.
Shelley, did you have, I had this whole range, my wife and I were caregivers, we had this whole range of emotions. Sometimes you laugh because you have to laugh because you might cry. Sometimes you're frustrated. Sometimes you're angry. Sometimes you're tired. All these things, and I think you have to allow yourself to feel those things as you go through it.
And I think I felt really lucky that I have a good support in my own family, personal family. But again, I mentioned I had siblings. We talked quite a bit about this, and and we laughed about it. I mean, some of the things are funny. Like one time Dad went out and he's going to get in the car. And he, of course, taking the car from a man I've learned is like taking their best friend. And, he obviously couldn't couldn't drive, and so he would not get out of the car. So this young caregiver was trying to get him out of the car. She couldn't get him out of the car. So we call my Uncle Moo, who played basketball here at WVU, who was then probably in his mid-80s at that point. And he tries to get him out of the car. That doesn't work. Dad is just not getting out of this car. And then finally he gets out of the car and then slams the door and calls his younger brother, who was trying to help him, all kinds of names on the way out. Yeah. But, I mean, it was funny.
Yeah.
He didn't have the keys because he couldn't go anywhere. So if he was out driving, it wouldn't have been funny. But we laughed about those things because he would laugh about him if he'd heard him about something else. Yeah. He always used to say he was going to end up like Tim Conway on the Carol Burnett show,
yeah, the old guy,
shuffling around. And, you know, in the end, that's pretty much what he looked like.
You know, my mom would, when she was staying at a facility in Morgantown, and a doctor and senator, she would get frustrated, and she'd say, and she was from Edinburgh, Virginia, and her 95% of her memory that she had remaining was about Edinburgh and growing up in Edinburgh. And we can talk about, you know, the memories that remain. And she'd said, tomorrow morning, I'm walking back to Edinburgh. I don't know how many times I heard that. And I'd say, well, you better have your long johns on because it's cold, and you better get an early start because it's 180 miles away or 200 miles away. So, you know, I knew she wasn't going to, and they weren't going to let her walk back. But rather than saying, no, you're not doing that, and that's crazy, I would just kind of roll with it, Doctor. Your thoughts about that?
And I think that's important to roll with it and be lighthearted about it. And I think what people need to understand is that Alzheimer's, they have difficulty forming new memories.
Right.
So old memories, often they can remember things from the past with exquisite detail.
Yes.
And the other thing is that they have a lot of fluctuations. Sometimes they can be on. They're like, wow, I have my mom and dad back the way they were. But then the disease fluctuates, and that's a characteristic of it. But you have to be aware that new memories are nearly impossible to form, very difficult to form, especially with advanced Alzheimer's. But old memories are very robust.
Well, we used to say, Doctor and Senator, we used to say my mom could name, we had her old yearbook, and she could name everybody in her senior class, but she couldn't remember what she had for lunch. Yes. Mm-hmm. Did your mom or dad revert back to old memories?
My mother did, absolutely, talked about her parents. Dad's form, and I you know, again, I do regret in some ways that maybe we didn't get their individual cases more diagnosed more deeply. I mean, I defer obviously to the scientists and the good doctor here, but maybe it was a different part of their brain that was affected first or whatever. Dad just kind of went silent on us. No talking, very little talking. Kind of staring at one point, I thought he wasn't really paying attention, and I was trying to do something gentle with him, so I was cutting his fingernails.
Yeah, we have to do those things.
Yeah. And I didn't know that he was really paying attention until I accidentally got part of his finger, and I mean, he got mad at me. So he was paying attention. He could feel pain, and so it was a little bit different. We took him one of the last times in Charleston. We took him out to see the state capitol, thinking, you know, all those years he'd spent there, and honestly drove right by, and we could have been driving by a 7-Eleven for all he knew.
Really?
No recognition at all, and that's where that was kind of startling to me, because it's like the doctor said, sometimes he would kind of fade in. But not that day. We
decided just to spend the whole hour this morning talking about dementia and trying to raise some awareness about it, let you know that you're not alone. And also, if you want help, and there's a lot of information out there, more than you can imagine, 800-272-3900, 800-272-3900. Dr. Rezai is with us from the Rockefeller Neuroscience Institute, and Senator Shelley Moore Capito. Both her parents went through dementia before passing. Dr. Rezai, you talk about early detection and what is being done, if anything, on early. We try to early detect everything else. Is there anything that is being done or can be done with early detection for dementia?
Yes, we need to do more studies, and here in West Virginia, we're among the world's leaders looking at how we can detect Alzheimer's earlier on using technologies of imaging and other techniques that we can help detect it earlier. And like cancer these days, you can detect cancer earlier, and we can even say, thank God, that somebody's a cancer survivor. We can detect heart disease, but that has not been translated for Alzheimer's.
No,
and that needs to be accelerated with research and innovation and public-private partnerships. And I really want to commend you, Hoppy, for having this dedicated hour, because raising the awareness is extremely important for people to know there's opportunities and resources available. And Senator Capito, I'm going to commend you for your efforts to legislate to help people. That's very important. So West Virginia is really a unique state for Alzheimer's, whether it has to do with legislator awareness and also what we have here for research and innovation. We're world leaders.
When you do a brain scan, you can see, right? You can see the parts of the brain that are damaged or not operating when you have dementia.
Yes.
So wouldn't the obvious thing be to get early detection so you have a baseline, get a baseline, and then keep getting checked like you do for everything else?
You got it. And that's why the brain shrinks over time. So if you get an earlier scan that gives you a prediction that you may have likelihood of getting worse, or now we're doing eye scans, a simple eye scan, an optometrist that can give you a risk profile. So that's what we're doing with artificial intelligence to predict using simple scans. Not now, but in 10, 15 years, you may have an increased risk. And then you can change your lifestyle and behavior to maybe reduce the curve of Alzheimer's and deal with it head on before it takes over you.
And Senator, I know you've played a key role. When I was at R&I, they spoke about your efforts to make sure there's funding to continue the research at R&I.
Right. Well, I'm fortunate to be in a good position being on the Appropriations Committee, but nothing compels you more, I think, as a policy leader than something that just hits you so personally like this did. And I went into the Senate, really, my dad died the day after I was sworn in. My mother died during that campaign. And it was just such a touch point for me to try to make a difference. And so working with Dr. Rezai here, we had the NIH Institute of Aging in early. We're going to have them back. We've had also the head of addiction from NIH to come in, because I think the research that's going on here at WVU and the innovative work that Dr. Rezai is doing with his team is, I want to try to shine a national spotlight on that, but also to encourage the work. And I mean, and you can do this through federal funding, but also through formulating the programs that fit. And I'll tell you what happens briefly in an appropriations bill. We're giving we're putting all this research still to AIDS and HIV, and that's very important. And it's almost like a contest of diseases. Mm-hmm. So, this is important. And when you look at the numbers and the cost, I just am really proud of what they're doing here in Morgantown. It's amazing, and it's fun to talk about among my colleagues.
Well, it's, as you say, and it is something that is, and what I found, and Senator, maybe you did too, is when you're going through it, you sort of end up talking to people about it, is how many people are going through it, have mm-hmm. gone through it, or fear they are about to go through it. And that's why as a layperson, doctor, I would suggest that at the very least, you have that difficult family conversation with your loved one about whether if you think they're going to go through it, or we better be thinking about this, or you think something's going on. Would you agree?
100%. And 1 in 3 seniors will have dementia. And
wow.
It's a big problem. There's no cure. There's no end in sight. So we need to really have a moonshot dealing with Alzheimer's and dementia. Is very important. So it affects everybody as you age.
Yeah. And
all families.
This helpline, there's a lot of resources out there, but you can start with this helpline from the Alzheimer's Association, 800-272-3900, 800-272-3900. And Dr. Rezai, great work you're doing at R&I. Senator Capito, I really appreciate the work you're doing, and also your willingness to share your personal story. I know that's not easy.
Well, I want to see other families be able to pick up that book and find out what to do, or to avoid it entirely. We've now seen a lot of trials of different medications. Dr. Rezai is doing a really innovative surgery, or well, it's not a surgery, it's a ultrasound mm-hmm. That has great promise. There's so much going on here. I just want to try to do what I can, but I loved my parents very much in sickness and in health.
Yep.
And I hesitated in the beginning to talk about it because it was difficult, but a lot of people are going through the same things and worse.
Yeah. All right. Senator, thank you. Dr. Rezai, thank you.